it's really important to figure out if you actually need a checkup before you start doing more physical activity. According to the American College of Sports Medicine, anybody with diabetes, I mean anyone, actually has a metabolic disease that they feel requires that you need to have a checkup or at least medical clearance. However, the American Diabetes Association and I both disagree on whether that really is true. For example, if you're going to just get up and do some light activity or some walking at your normal pace or whatever, it really is overkill to have to get checked by a doctor first before you do that. In fact, sitting on the couch is more likely to kill you than getting up and being normally active. However, there are some instances in which it might be a good idea to either get a checkup or have your doctor tell you that you're cleared to be more physically active. So everyone kind of needs an annual physical exam anyway, so I'm really just talking to people who haven't had that sort of normal checkup on a regular basis. If you're planning on doing any activity that is really intense, like particularly more intense than anything that you've been doing, it might be a good idea to get a medical checkup. It also might be important if you have any symptoms, for heart disease or any other pain in your legs when you're walking or anything. It might be good to get that checked out to make sure that it wouldn't be a problem. It's also recommended that you potentially have an exercise stress test if you are over the age of 40 or you're over the age of 30 and you've had diabetes for longer than 10 years, or if you have any known health complications associated with diabetes. For example, if you already know you have some plaque formation in your arteries or any other signs or symptoms of heart disease, if you have some bad eye disease, proliferative retinopathy, or if you are on dialysis, for example, those types of things might be good to definitely get a checkup first, and then your healthcare provider would decide if you need to have an exercise stress test. But for most people deciding to do light to moderate activities, you don't need to do that. Just go ahead and get up and start being normally active. Go for a walk, engage in your normal activities, and you should be fine to go.